What are ECG interpretation mnemonics? Have you ever looked at an electrocardiogram and felt overwhelmed by all the lines and waves? If so, you are not alone. Understanding how to interpret an electrocardiogram can be challenging, but mnemonics can make it easier. So, what are ECG interpretation mnemonics? Let's break it down. Electrocardiograms are tools that record the electrical activity of the heart, helping to identify heart-related issues. To interpret these complex recordings, mnemonics serve as memory aids. They provide a structured way to analyze the essential components of an electrocardiogram. Before diving into mnemonics, it is important to know the basic components of an electrocardiogram. First, there is the heart rhythm, which is the pattern of electrical activity. Next is the heart rate, indicating how many beats occur in 1 minute. The cardiac axis shows the direction of electrical activity through the heart. Then we have the P wave, which represents atrial depolarization. The PR interval measures the time from the start of the P wave to the beginning of the QRS complex. The QRS complex itself indicates ventricular depolarization. Following that, the street segment is the period between ventricular depolarization and repolarization. Finally, the T wave represents ventricular repolarization. Now let's look at some common mnemonics for interpreting electrocardiograms. One popular mnemonic is rhythm rate IMPQRST. This helps remember the key components to analyze. Rhythm refers to the heartbeat pattern, while rate is the number of beats per minute. The letter I stands for ischemia or infarction, which looks for signs of heart damage. The letter A represents axis, indicating the direction of electrical activity. M stands for morphology, which describes the shape of the P, QRS, and T waves. Lastly, PQRST reminds you to check the intervals and waves of the electrocardiogram. Another useful mnemonic is heart. In this case, H stands for hypertrophy, which looks for signs of thickening in the heart muscle. E represents the extent of intervals, evaluating the duration of PR, Q'd, and QRS intervals. A again refers to the axis, while R stands for rhythm and rate. Finally, T highlights T wave abnormalities. Using mnemonics in electrocardiogram interpretation can greatly improve study efficiency and accuracy. By following a systematic approach, students can ensure they cover all necessary aspects, reducing the chance of missing critical information. This method also helps in identifying patterns like bundle branch blocks or ischemia more effectively. To memorize these mnemonics, consider some study hacks. Repetition is key, so try repeating the mnemonic several times each day. Visualization can also help. Associate each letter with a word or image that is easy to remember. Practice applying the mnemonic to real electrocardiogram examples to solidify your understanding. Creating flashcards with the mnemonic on one side and its meaning on the other can also be beneficial. By incorporating these study techniques, learners can master electrocardiogram interpretation mnemonics and improve their ability to analyze electrocardiograms effectively.